Hi, Jackie Van Ruller here, and in today's video, I'm going to be talking about urinary tract infections. If this is something that you are prone to getting, you can do this protocol preventatively, or when you have the very first signs of a urinary tract infection, this is a great protocol to do frequently to help prevent that infection from setting in and you needing antibiotics or something else to take care of it. So urinary tract infection symptoms are often feeling pain with urination, needing to urinate frequently, feeling like you have to urinate even if your bladder is empty, or having some low back pain as well that signifies the kidneys. Now, people that are very, very young, babies and or elderly adults, oftentimes don't have these symptoms, or particularly in the elderly, some of these symptoms are just common. They're not normal, but they can be common for you to have as you get older. So you may not notice it as a urinary tract infection. And additionally, urinary tract infections in the elderly can result in things happening like furthering dementia or other mood changes or falls or things like that. So a lot of times when people have like a sudden change in their health, one thing you can look for is a urinary tract infection. So we're going to start right up here, right at the top of your forehead at the hairline. If you don't have a hairline, you can just kind of guess where that would be. And this is going to be a point for the bladder. This is a point you want to start with and not end with, because this point will cause energy to rise to your head, and so it can trigger a headache if you use it as one of the last points. Then we're going to work we're going to go down just a little bit further from that, and this is a point to activate the immune system. So about a fourth of the way down your forehead, right in the center. Then we're going to work your kidney points. Kidney points are going to be touching the corners of your mouth, following that all the way up to your hairline, coming down a little bit. You might feel an area where your fingers kind of fit into that spot. Those are going to be your kidneys. So working those points. Notice if anything feels lumpy, bumpy, tender, or just feels really good. Those are the areas that need the extra love and attention. And then we're going to work two more points on the forehead, and these have to do more with just relaxing the nervous system in general and decreasing any pain. So halfway up your forehead between your brow and your hairline, and then about 2/3 of the way across, you can just go back and forth. This is activating a point for deep relaxation and sedating the nervous system. This produces a wonderful chemical called GABA that helps to calm an irritated nervous system. So anytime you have something going on with your body, it's usually because your nervous system is out of balance. And so as we're doing this, we're just trying to calm an overactive nervous system. The next point we're going to work is right at the inner brow. So right in here, a little bit above and to the side. And this point also activates and sedates the nervous system, so helping to calm it down, decreasing pain, decreasing pressure, and just helping your whole nervous system to work better. Then we're going to work a couple of points for inflammation and activating the immune system. So on the corners of your mouth, right in here, you can work this area. You don't want to get into this part of the lip if you're pregnant, so just make sure you're staying right on the corners of the lips there. You can be more prone to urinary tract infections when you are pregnant, because you have a lot more pressure on that bladder. This area right in here, as you're working within that smile line, is great for activating the immune system. It's activating more white blood cells to kill any bacteria, viruses, things like that that shouldn't be within your urinary tract. And then working that other side. If you're noticing that one of these is more tender than the other, that's the side that needs to be worked. Coming underneath the lip right in here, this is a point that's a diuretic point, so helping you to get rid of extra fluid and inflammation. And this side. And then coming down and working the entire chin. A lot of times when you have urinary tract infections, it will show up on your chin. I've seen people get like a big zit right in the center. Some people just get a lot of redness within the whole chin. Bumpiness, rashes, things like that can all show up on your face. And sometimes you can get some without it necessarily showing up, but it might feel more lumpy or bumpy or irritated. Just working that whole chin area thoroughly. And then as always, we're going to finish up by working all the way around the ears. Incidentally, the ears are also related to the kidneys. And so as you're working the ears, you're activating and energizing the kidneys so that they can protect themselves from viruses, bacteria, things like that are in your blood. So circling down the front side, coming up and around the back side. And same thing here. If you don't have a magic wand yet, I will leave my email address in the description below. This is a $63 tool. I do ship it for free within the US. It was likely to save you probably hundreds, even thousands of dollars on your healthcare bills, because when you can take care of a lot of these things yourself, so it's going to save you how much money you would otherwise spend with your doctors or things like that. So I highly recommend that you learn at least a few of these facial reflexology protocols that are going to help you out. Invest in this, and I think that you will find that you are a lot healthier and happier. Additionally, if you're not subscribed to my Instagram channel, you can subscribe at Jackie Van Ruler, and I do post these face maps that go along with these videos on my Instagram channel, so you can find them there. Be sure to like this video and subscribe, and also let me know what you notice through doing it. Thanks for watching. Bye.